The gingivitis is a type of periodontal disease that causes swollen gums. The cause is poor oral hygiene. Untreated gingivitis can lead to tooth loss and other serious conditions. Symptoms include gums that are swollen, retracted, sometimes tender or bleed easily.
Hello, I'm Gingivitis, and today I'm going to talk to you about gingivitis. First of all, what is gingivitis? Gingivitis is an acute, short-term inflammation of the gums. And what causes it? There are many causes, but the main cause is dental plaque, but it can also be caused by hormonal changes, such as pregnancy, and certain medications for hypertension and epilepsy. So let's begin. First, I'm going to show you a picture of a healthy gums. This is a patient who brushes twice a day and flosses at least once a day. You can see the gums are pink in colour, they have sharp edges, they're firm and they don't bleed. So a quick way to remember this is, healthy gums don't bleed. Now, if we were to stop brushing the teeth, stop flossing the teeth, dental plaque, which was being removed before, would be allowed to build up. Once this builds up, it solidifies and this irritates the gums, causing them to become red and inflamed. This, in the short term, is called gingivitis. You can see here the colour change from a pink to a reddish. The edges have become much more rounded and the gums look a bit more puffy than they were before. The good thing about gingivitis is it's reversible, meaning if you first start to see blood when you're brushing your teeth and when you spit out the toothpaste, it's time to go and see a dentist, because it could mean after a professional clean, your gums can revert to the healthy state they were once in. But you also need to maintain good oral habits not to go back to gingivitis. If gingivitis is not controlled, it may progress onto a serious disease called periodontitis, which eventually causes the gums to break down and the teeth to eventually be shed, which is the major cause of tooth loss. It's also very important to remember that in 85% of cases, gingivitis is not painful, meaning you won't know if you have pain. The only symptom you really have is when you're brushing and you'll see blood appearing when you spit out the toothpaste. So it's important, once you see the symptoms, visit your dental practitioner and get a professional diagnosis. Thank you very much for listening, and just remember, keep those teeth healthy and keep smiling. Take care.
Application in dentistry. The gingivitis is the first stage of periodontal disease, which involves inflammation and in more serious processes like infection, and can end up destroying the supporting tissues of the teeth, including the gum periodontal ligament and dental alveoli. The pros and cons. It is a disease that has a cure if it is treated by the health professional. The treatment is short and not painful. It can cause food loss and excessive bleeding and cause a bad smell in the mouth.
Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and today I want to talk a little bit about an extremely common problem. In fact, 70% or more of our population has it, and that's gingivitis. Gingivitis means inflammation of the gingiva or the gum tissue. There are two kinds of gingivitis. There's plaque-induced gingivitis and non-plaque-induced gingivitis. Plaque-induced gingivitis is usually caused by lack of adequate oral hygiene or home care. Non-plaque-induced gingivitis can be a number of other factors. It can be viral, it can be systemic, it can be due to local exposure to other factors, chemicals, but the most common is the plaque-induced gingivitis, and that is the one that typically can lead to what's called periodontitis. And periodontitis means that it's involving the area more beyond just the gum tissue, but the surrounding supporting tissue of the tooth, the bone, to be specific. Now, periodontitis tends to be more severe. You start losing bone, you lose the support of the tooth, you lose the tooth. But if we can catch it in the gingivitis stage and eliminate the gingivitis, very often we can stop it at that point and prevent it from getting to the periodontitis or the more serious stage of bone loss and potential tooth loss. In plaque-induced gingivitis, some of the symptoms that we see are redness, bleeding, little tenderness of the gum. Sometimes there is not much in the way at all. So if we have a patient who comes in, we will automatically take a sample of the plaque and the bacteria that are in the plaque and see if there are pathologic or pathogenic bacteria and or parasites in there. And we can catch that and treat it early to prevent periodontitis. If it's very early, just really good home care, good cleaning at your dental office and good home care on your part, if you're taught properly how to do it, can eliminate the plaque that causes gingivitis and therefore very often eliminate the periodontitis that would follow. As far as home care is concerned, I think it's important to clean between the teeth, either with floss or interdental cleaners, so that you remove that plaque thoroughly between the teeth, because typically that's where gingivitis and periodontitis start. Brushing thoroughly, I'm not sure that the type of toothpaste that you use makes a real difference, but brushing thoroughly makes a big difference. Using a water cleaning device can also be very helpful, because sometimes cleaning between the teeth with floss and brushing doesn't remove everything as completely as it might, but the water cleaning device can stimulate the tissue and remove particles that may be missed otherwise. So really good home care is the key to treating gingivitis, the early stage of gum disease. Thank you for watching. Don't forget to subscribe. If you have any comments or questions, don't forget to leave them below. And remember, take care of yourself. You have a healthy mouth. You're going to have a healthier body. Have a great day.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.
The conclusion: the gingivitis can cause very severe complications in our mouths. Tooth loss is one of the most common to this disease. Proper treatment can help prevent the disease from progressing. Thank you.